Hey everyone, welcome to Food Talk Live with Dani Nierenberg. I am so excited today that amidst all the craziness, I get to talk to somebody who makes me feel a lot better about a lot of different issues. Today we have Bob Martin, the Director of Food Systems Policy at the Johns Hopkins Center For a Livable Future, which is an amazing institution. You should check it out. Just Google Center for a Livable Future at Johns Hopkins. I have known Bob for a very long time. We happen to live in the same city, but because we're being responsible and self-isolating, we're doing this virtually. And he's been a real hero to me because of his work that's been really groundbreaking on the public health and environmental impacts of factory farming when he worked at Pew. He's been doing this work for so long, studying the connections between how we produce food and the impacts on both our own health and the health of the planet. Bob, I want to thank you so much for joining me. It's always a pleasure to have your expertise.
Well, Dani, thank you for asking me, and it's a real pleasure and honor to be with you today. And as you can tell from my unprofessional backdrop, the Center for a Livable Future has moved to remote work, starting about last Wednesday when the school announced that all classes, undergraduate, School of Public Health, and all graduate courses would be done remotely for the remainder of the year.
That's so challenging for you all. I mean, it's not just, trying to get groceries and make sure that we're washing our hands. It's students still have to learn and complete their degrees. So I really commend you and all of our good friends at the center for keeping the work going. You have to, especially now more than ever.
Yeah, thank you. It's our students are amazingly resilient. One of the things I like best about the center is the really large cadre of students that are so smart and so talented that I get to interact with. It's one of the positive things or hopeful things about food system work, I think.
Absolutely, and I feel the same way. We work with a lot of graduate students and interns who are really incredible thinkers and doers. And so having them sort of in my life during this very chaotic time gives me a lot of hope because they're, hopefully we'll solve a lot of these problems before they have to and need to, but I feel very hopeful about the future because of them. Bob,
one of the things.
Yeah, go ahead.
I'm sorry, one of the things I'd interject is I've been to several of your summits in person. And the audience that you pull from around the country to be there in person tend to be those really smart, talented young people. So you've done a great job in getting those parts of the population energized and involved.
We've really tried, and I know that's something the center has done very well too. And I think those are the kinds of people, young people who are knowledgeable or pushing back. I've learned so much from them. I have very little to teach them at this point. I'm learning so much from the way they question what Food Tank does and who we are. And so I think it's really brought so much enrichment to what Food Tank as an advocacy and research organization does. So I'm really grateful. Before we sort of get into COVID-19 and all of the work you're doing on creating a role for citizen eaters in not only the presidential election, but other elections, I want you to give us a sense of what the Center for a Livable Future, which is such a great name. I mean, when I started working in this field, I was just so excited that there was a research institute that had that name because it's so hopeful. Can you talk about what you all do and why it's placed at Johns Hopkins?
Sure. We were founded almost 25 years ago by Dr. Robert Lawrence and Dr. Polly Walker. And Bob was the first director of the center until about 3 years ago. And he was a physician by training, but he has strong grounding in public health. And he became the associate dean at the Bloomberg School of Public Health in '94, I believe, and wanted to establish a center that would bring the disciplines of public health together with the impacts of food production. And the dean of the school at the time was Dr. Al Sommer, incredibly supportive of that kind of unique approach. So we work at the intersection of food production, public health and the environment is the way we tend to say it. So I think the center started with about 3 or 4 people. We're now up to over 30.
Nice.
We have 4 programs. We have a very strong educational component to our center. We have research component, obviously, and then I kind of fall in that area because I'm not a public health trained person of public health practice, and I was not that familiar with public health work when the Pew Commission started in 2005.
Right.
And I got to know, we were housed at the Center for Livable Future, and Bob Lawrence was one of the PIs, principal investigators for the commission. And we relied a lot on Hopkins' scientific talent and expertise. And so I gained a healthy respect and admiration for that approach to things. And I feel fortunate to be working there.
Absolutely. And I think what a lot of folks don't understand is that at the time that Dr. Lawrence started, CLF, and the time you were coming up through the Pew Commission, is that thinking about the impacts of public health and how we produce food, that was not something that was being discussed. That was revolutionary. And we're now only getting to this world where, oh yeah, of course, nutrition and how we produce food and how we treat workers and how we treat animals, these are all things that are very interconnected. So, I mean, a real shout out to the work that's been done that you were such, a part of to make those connections possible and to make it possible for people like me and Food Tank. Sorry, sirens are going by. It's Baltimore, Maryland, y'all. To do this work and to start making those connections, and more importantly, start coming up, with ways to highlight the solutions that are out there. You know better than anyone that there are solutions to the biggest problems we're seeing right now in the food system, whether it's the spread of infectious zoonotic diseases or the impacts of climate change. There are solutions to these things. And that actually makes me feel better that you know some of these solutions during this really time of crisis. You've studied and talked a lot about factory farming and its spread across the United States and across the world. And we've seen how H1N1 and avian flu and SARS, over the last 20 years have had a big impact, but nothing has been as big, I think, as COVID-19. And we're, from what I've read so far, we're not really sure how this first started, but it's probably with wet markets and animals being close to humans and in very densely populated places like China. Can you talk about, sort of zoonotic diseases in general and why they've been emerging over the last 2 decades?
Certainly, yeah. I think on COVID-19, we are still not the center, but public health experts are investigating the origin of it. It could have been from the wet markets, as you said. There's some speculation that eating marketing of wild animals in that wet market was the jump. But I think there is a real strong link between the way we produce food animals and the emergence of some of these novel viruses. And it gets to the prevalence system of the industrial animal model, which animals are overcrowded. They're in an unhealthy environment. The transmission and mutation of novel viruses, I think, are escalated in this. The time that it takes for a novel virus to emerge is compressed because it's generated so quickly, the changes are generated so quickly. And about 67% of the diseases in the world are of zoonotic origin. And
explain for people, sorry, zoonotic. Can you explain that term just so that everyone's on the same page? These are kind of crazy words that people are hearing in the news and they don't always know what they mean. Yeah,
sure. Zoonotic is a virus or a disease that originates in animals that jumps to people. HIV was determined to be a problem in primates that jump to people. Avian flu, as you said, is a very good example. And some novel flu viruses coming from swine operations. and so the structure of the system, I think, encourages that, or puts a little bit of a escalating or an intensifying aspect to it. And it is the system was devised in the United States, and we have exported it all over the world, as you've said. And one of the things that we talk very generally about the concern about a novel virus coming out of these operations in the Pew Commission report, and it's because of the animals, especially swine, that are packed in together, and the virus can mutate quickly, and it facilitates a jump to the workers in the concentrated animal feeding operation.
Yeah, the people who are already most at risk because they're working with animals every day, they tend to be, economically disadvantaged, underserved, so they're not going to go to the doctor when they start coughing.
Right, economically disadvantaged, don't have health benefits. Many times they're undocumented workers, and so there's a bit of a reticence for them to engage in the health system unless they're very ill. And a recent development that's even more concerning, I think, or adds to my concern, are areas like North Carolina where they're co-locating poultry operations, broiler operations, the operations that we use to raise chicken for human consumption, with swine operations, and they're in the wild migratory flyways. So the main repository of avian influenza in the world is wild waterfowl, and it's not a crazy science fiction scenario for a duck waste or droppings to get into the broiler CAFO, then it moves to the swine CAFO, and we have so many physiological similarities with pigs that a really serious avian-oriented virus would jump to people. So,
absolutely. And just to be clear, CAFOs are confined or concentrated animal feeding operations where you're putting thousands and thousands of animals all together. We typically call them factory farms or industrial farms.
Right, right.
And you talked a little bit, and I did too, about the really groundbreaking work you did with the Pew Commission report in 2005. And that was really one of the first times that those connections between how we produce, animals for human consumption, the effect that has on public health. What were you most surprised about when you were doing that report?
Well, that's a very good question. I think that the thing that most surprised me is how easy it would be for an animal origin illness to jump to people. I did not have a public health training or background. I had a political background, and it struck me that if we wanted to design kind of the perfect petri dish to develop a real problem with viruses, not to mention the problem of antibiotic-resistant bacteria that can come out of these operations because of the inappropriate use of antibiotics in them, I was shocked at how this design almost, you couldn't design a better system if you wanted that outcome.
Right, right. And so, antibiotics, I don't know if everyone knows this, antibiotics are used in animal production for a variety of reasons. One is, and I think this is still the case, that it's believed to increase, yields. In fact, farmers believe that it'll put more pounds on their animals, to be very blunt. And then the other sort of reason is that the animals, when they're confined in these operations, often get very sick. And so the antibiotics are used sort of preemptively to prevent those sicknesses. And Bob, correct me if I'm wrong, 80%, something like that, of all antibiotics are used on animals, not people. Is that still a pretty fair statistic?
Yeah, that's pretty close to, based on what FDA statistics have shown, and they haven't been collecting the data that long. I think it's been 5 or 6 years now, and there is the estimate too, based on that data, that about 72% of the antibiotics that are medically important, that is, that we rely on to fight infections and the human population are used in food animal operations. And the way they're used is particularly troublesome. You're right, they're given to suppress bacterial development because again, these operations are perfect for breeding bacteria. The animals are crowded, the waste is not handled properly.
Right.
They're warm. And so to keep the animals healthy, as you said, as they move through the system, they're given low-level doses of antibiotics. It used to be, it's kind of interesting, the main reason used to be growth promotion. They did gain weight more quickly. Growth promotion has been eliminated as an appropriate use in the United States. But interestingly, disease prevention is still allowed, and the way antibiotics are used for disease prevention now are identical to the way they were used for growth promotion. So it's not really eliminating that inappropriate use.
Right. And it's that inappropriate use that, as you mentioned, makes it harder for doctors to treat people with real illnesses, because there's a lot of overuse and misuse. And so it's something to keep in mind, especially while we're going through COVID-19. Just, there's a whole range of healthcare practices that are compromised right now. And, it's important to stay as healthy as possible. But so I think for a while in the United States, these industrial animal operations, factory farms, CAFOs, whatever you want to call them, they were sort of seen as like, this is how we produce food. But I think the tide is changing. And I believe the center just published a report about how Iowans, people from Iowa, feel about the CAFOs in their state. Can you talk a little bit about that report?
Sure. We have this ongoing project that you mentioned in the introduction called the Food Citizen Project. And it's designed to provide regular public opinion information about the food system, so we understand the types of reforms that people want to see.
Mm-hmm.
We just did a national poll, as you referenced, last December on proposed moratoriums on these large animal operations. And we did a deep dive in 2 states, Iowa, because that is really kind of ag central and hog central.
Zero, for
Yeah.
sure.
And because they've been discussing a state moratorium there for about 3 years now. And then we also did a deep dive in North Carolina because there's a failed moratorium there. In the mid-90s, they put a moratorium on new swine operations, but they grandfathered in existing operations that they could expand, and they didn't limit other species. So that's why you see the existing swine are expanding and poultry operations are going in. So what we found...
just for a second, is it still true that in both North Carolina and Iowa have more pigs than people in each state?
Yeah. Yes.
Dramatic.
Yeah, it's, and they're 1 and 2 in the country. It's really... well, and so much of the swine operation in North Carolina is just down in that little coastal plain in southeastern North Carolina that
So vulnerable.
It's just high water table, high poverty. So the environmental justice issues are pretty profound in North Carolina. But what our polling showed was that people nationally are interested in halting the development and expansion of these operations. And even in Iowa, while people recognize the economic value of these operations to the Iowa economy, they support a moratorium until the water contamination, water pollution issues are addressed. It's about 63% of Iowans supported that, and a majority nationally supported it.
I just have to say that again, like 63% of Iowans. That's a huge number. That's amazing.
Right. And it's interesting, some of the other polls we've done, our first poll was on the dietary guidelines, as you remember, the fight about it, including sustainability in the guidelines, and it didn't make it, but it was about 82% of the people nationally supported sustainability across all party lines. It wasn't a political issue.
Right.
We did a deep look into Maryland about regulation of the poultry industry, because that's the industrial system that we have so much, as you know, on the Eastern Shore. And even people that recognized on the Eastern Shore how important poultry production was to the economy, it was in the low 80s that people wanted regulation of the industry. So I think there's a more awareness. I mean, you through Food Tank have done such a good job communicating these threats and educating people. I think we're starting to see some of that show up in these polls. So the purpose of the Food Citizen Project is to provide ongoing, public opinion information for advocates.
Yeah, absolutely. And let's talk a little bit more about the politics of this all. You mentioned, that there's more awareness among consumers, and there's, this growing, I think, need and craving that consumers want to know more about where their food comes from and how it was produced and who produced it, and how animals and the land were treated, and how farm workers and farmers are treated. But you've made this you've distinguished between what is, a conscious consumer, and then, who is a citizen eater. And, I want you to sort of talk about that first, and then maybe we can get into what the role of the citizen eater is right now, when we're not allowed to go out and make, as the kind of food choices that we may have made differently a couple of weeks ago. So what's a conscious consumer versus a citizen eater first?
Well, yeah, so in some ways they're very similar. I mean, a conscious eater, I think, is more thoughtful about their food choices and trying to understand, the origin of their food, how it's produced, the impacts it has beyond just their personal pocketbook. And I guess a good way for me to explain a food citizen is to talk about something that I hated when I was in politics, which is a single issue voter. I didn't really like those when I was trying to get people elected to office, because they discounted too many other issues. But I think that's what our hope is, that we can help inform people whose food is their primary political issue, how it's how it's raised, the impacts on communities, the impacts on producers, and I think there's, again, back to the younger folks that are so great to work with. I think that generation is really helping move that perspective along quite a bit.
Absolutely. This is a question I've asked a lot of people, folks like Sam Cass and Kimball Musk and others who I, respect, and, Anna Lappé and her cool mom, Frankie Lappé. Do you think there is a food movement in the United States? Do you think there's an actual movement?
Well, I do. It's a little bit different than other social movements. I do think food is kind of the social issue of our time, when we're not worried about being wiped out by a novel flu virus, which may, as we've been talking about, may have an animal origin. In one sense, it's different than movements I was watching growing up. I remember as a young person the civil rights movement very clearly, in how there were a couple of well-articulated goals and lots of leaders, but they all focused on the same couple of goals. Another one I watched, and it was easier because the goal was to end the Vietnam War. It wasn't easier, but it was more focused. So I think there is a food movement. It's not quite as pointed in like one or two solutions or goals as other movements may have been, but it is clearly motivating people like issues I've not seen until recently.
Absolutely. And again, this is where young people are really making that galvanizing and creating that momentum that needs to happen to create an actual food movement that has a political force behind it, and that has money behind it, and that can make actual change. One of the things I'm worried about right now with COVID-19 is that so many research centers like yours, who have been focused on creating resilience in the food system, that work is now a little bit compromised by COVID-19. How can we make sure that those efforts to create resilience in the food system, whether it's resilience against, sort of fluctuating food prices or the impacts of climate change, how can we make sure that, this is obviously very serious, and COVID-19 needs to be contained, and we need to figure out, the proper measures to prevent it, and vaccines and all of that. But we can't forget all of the other things that we've been working on. So what advice do you have for, young researchers, people who've been in, researching for a long time, or for all of us? How do we keep the efforts to make sure that the resilience and the regenerative agriculture practices that have become so popular, how do we keep those going?
That's a very good question, and I think this virus is really kind of overwhelming a lot of public health work. Interestingly enough, we have some researchers at the center. Dr. Ronnie Neff.
Dani Nierenberg.
Yeah, she's
the greatest.
Yeah, she's worked a lot with Baltimore City to develop kind of a resilience plan that originally was, I think the primary focus was in case of a natural disaster.
Mm-hmm.
How is the food system going to respond to that? And through that work, really, because the mayor of Baltimore and the food czar in Baltimore, Hani Frechette, really has networked.
With another shout out, I went to a graduate school with Holly. I love her. She's doing incredible work.
Yeah. So because of her leadership, and Baltimore's always had a leadership role among mayors, Ronnie's helped develop, plans for other cities. And so, if before it'd been a natural disaster, but Ronnie's been very involved now, planning research with other academics, and she and a colleague of ours, Erin Beal, published an op-ed in The Hill last week, talking about how this virus is a disruptor like a natural disaster would be, and things to worry about, like food security, disrupting the food chain, supply chain, and those sorts of things. So the center is, I think, because of that type of focus or perspective, our resilience work won't really, or our regenerative ag support won't really diminish, because it's all really part of one thing, right? We're worried about farmers markets not being disrupted, and because of the producers, not only is it a good source of healthy food, but the types of producers that supply farmers markets, yeah. Are the type of agriculture that we like to support. Ann Palmer, who runs our Food Communities and Public Health program, she and Karen Bassrab and Rachel Santo work a lot with food policy councils around the country. And so we're helping support food policy councils' response to the disruption in the food chain for their communities. So, and we've got a Meatless Monday program that's run by Becky Ransing at the center. And there, she and Daphne Atima Johnson are working to promote, like, cooking at home, for example, right, in this time of disruption. So it's interesting. We've got all these different programs that have been operating, and it hasn't been focused on a virus, obviously, but there are things we can do to keep promoting the more sustainable regenerative system that also addresses the problems of the virus. And one of the policy people that works with me, Sarah Goldman, and I have been testifying. Sarah's done a great job testifying in Annapolis on some sustainability issues, regenerative ag issues. And we've worked well with, we're a member of the National Sustainable Ag Coalition.
Right.
And so we're trying to, participate on the federal debate on some of the response to COVID from an ag perspective through insects. So it's kind of overwhelming, but we're doing our best.
Absolutely, and thank God. I mean, thank whoever you thank, but I'm grateful that people like you and all of your colleagues, and are doing this work and doing it so well and keeping it going, even though I know it's a scary time for all of us. Before I ask sort of the final question, can you tell us where to find more information about the Center for a Livable Future?
Sure. We have a really good website. It was just been redesigned by our comms team led by Chris Stevens. And you can just Google Center for a Livable Future. We're in the process of developing a specific segment in the webpage, should be up next week, talking about all the COVID-19 resources that we're bringing to bear through our work. But it's like www.livablefuture.com, I think. But if you Google Center for a Livable Future, you'll find it.
And we'll make that available on our social media platforms and on the Food Tank website, so everyone will know where to get more information. So,
yeah, thank you so much.
No, our pleasure, and thank you for all the work that you've been doing. And just one general shout out to you. You're so good at recognizing and commending all of the people you work with. I talk to a lot of men in the food movement, and they're not always so good about commending all of the great people who work with them. So that's something we can all learn from you. Thank you for doing that.
Yeah, thank you.
I'm losing my voice from talking to so many people over the last few days, but my final question is sort of a personal one. How are you and your family keeping your spirits up during this really sort of, unnerving time where we don't know what's going to happen from day to day or from hour to hour?
Well, that's a very good question. Our daughter and son-in-law live about an hour north of Germantown, Maryland. She's a teacher in South Central Pennsylvania, and he's a personal trainer. And I think it's just, we try to kind of encourage one another, recognize this is tough, but we'll get through this. Do basic things, wash your hands, keep a social distance. But it is hard. I mean, I think we've all in the last week or so at different times, been concerned. Some of the erratic response initially from the federal government was very concerning. Weak response, not recognizing the threat this posed. We've had a pretty strong response since you're in Baltimore too. You've seen Governor Hogan be pretty aggressive. So I don't know. I think when one of us kind of gets down, the others, are encouraging. But it's tough. Earlier in my career, I was working on the Hill, and a lot of people forget this happened a month after the 9/11 attacks. The office building I worked in, a letter full of anthrax, active anthrax, was opened, and I was about 100 feet away from the office. It was opened, and when I was walking by, and we were displaced for 96 days as they tried to deal with it. And so part of me thought, working remotely now, it's like, oh no, not again. I mean, and that was a fairly, for a while, it was like they didn't know how they were going to remediate the anthrax spores in the building that I was in. They finally got it done. So I think there's a bit of like, well, we can figure this out if we just don't, panic.
Absolutely. And you're not the first person to say that. Human intellect and resilience, we can figure these things out. It might take a while, but there's a lot of really intelligent people out there, and a lot of really motivated people like yourself who are doing incredible things. So thank you so much for joining me today. I know it's chaotic times, so I appreciate whatever time you could give me. But I hope you stay well, and I hope to see you in person very soon when we can all congregate at a restaurant or a farmer's market and feel safe and secure again.
Dani, thank you again for inviting me today, and thanks for all you do through Food Tank.
Thank you so much, Bob. Stay well. Bye.
Bye-bye, you too.